Hello, welcome to Nursing Guru. Today I am going to talk about teeth. Teeth. The teeth from a part of the chewing and masticated appearance are fixed in the jaws. In man, teeth are replaced only once. The teeth of the first set are known as milk teeth or deciduous teeth, and the second set as permanent teeth. The deciduous teeth are 20 number in each half of each jaw. There are 2 incisors, 1 canine and 2 molar. Permanent teeth are 32 numbers and consist of 2 incisors, 1 canine, 2 premolar and 3 molar in each half of the jaw. The deciduous teeth are usually shed between 6 and 12 years of age and are replaced by permanent teeth. The permanent teeth is usually completed by 18 years of age except for the third molar. So we can move on different type and part of the teeth. Each tooth consists of 3 parts: a crown, neck and root. The crown is the part the object from the gum and meats with 1 or more teeth is opposite jaws. The neck is the part of between the crown and the root. The root is fixed in the alveoles by the periodontal ligament. Each adult jaw consists of chisel-like incisor, 2 tearing teeth called a canine, 4 premolar and 6 molar. Next we can move on to the structure of the tooth. Most of the tooth is composed of dental that is covered lingual by enamel over the crown and cementum over the root. The pulp cavity contains connective tissues, blood vessels and nerves. It is continuous with the periodontal tissues through the root canal and root foramen. It is continuous with the periodontal tissues through the root canal and root foramen. The root canals transmit the nerves and vessels to and from the pulp cavity. So next we can move on vessels of the teeth. The branches of maxillary artery supply the upper and lower set of the teeth. The veins is join the pterygoid venous. Lymphoid vessels drain mainly into the submandibular nodes. So next we can move on nerves of the teeth. The teeth of the upper jaw are supplied by maxillary nerves. The lower set of the teeth are supplied by inferior alveolar nerves. So next we can move on vessels on the teeth. The branches of maxillary artery supply the upper and lower set of the teeth. The veins join the pterygoid venous. Lympho vessels drain mainly into the submandibular nodes. So we can next move on nerves of the teeth. The teeth of upper jaw are supplied by maxillary nerves. The lower set of the teeth are supplied by the inferior alveolar nerves, a branch of mandibular nerves. So far we discussed about the topic teeth. You have any doubt, do comment and like and subscribe our Nursing Guru YouTube channel. Thank you.